pas à toi, tu es à moi, que cela résonne et pèse une tonne dans ton cœur, lourd et sans peur. Mais qui est la rose fanée? Je prends vie.
Dorothea Orem's Self-Care Theory. Introduction. Dorothea Orem was born in 1914 and died 2007. She was one of the foremost nursing theorists. Born in 1914 in Baltimore, she earned her diploma at Providence Hospital at Washington, D.C. She had a bachelor degree and a master degree as well. She earned her bachelor degree in 1939 at Catholic University of America, and then in 1945 she completed his master degree on science in Catholic University of America. She was involved in nursing practice, nursing service, and nursing education. During her professional career, she worked as a staff nurse. Also, she worked as a private duty nurse, a nurse educator, and she had administrative role, and she was nurse consultant as well. Dorothy received honorary Doctor of Science degree in 1976. She published her first formal articulation of ideas in nursing concept of practice in 1974, and the second one was published in 1980, and third one was published in 1995. Development of her theory. From 1945 to 1957, Orem worked for Division of Hospital and Institutional Services of Indiana State Board of Health. Her goals during her work was to upgrade the quality of nursing in general hospitals throughout the state. During this time, she developed her definition of nursing practice. In 1959, Orem served as acting dean of the School of Nursing and as assistant professor of nursing education at.
Good evening, my name is Lakshmi. Today I am going to discuss about the Dorothea Orem's theory about the major assumption of the theory. So Dorothea Orem theory, according to major assumption of the theory, the Orem's theory is described the human beings should be self-reliant and responsible for their own care and others in their family needing care. People are distinct individuals. Next is nursing is a form of action. Successfully meeting universal and developmental self-care requisites is an important component of primary care prevention. A person's knowledge of potential health problems is necessary for promoting self-care behaviors. Self-care and dependent care are behaviors learned within a socio-cultural context. So next I am going to describe about fundamental Orem's theory. So according to Dorothea Orem's theory, the fundamental Orem's theory is classified into three. That is self-care, self-care deficit, and nursing system. So here I am going to describe about two, the self-care and the self-care deficit. So the first, self-care. The theory of self-care includes self-care, which is practice of activities that an individual initiates and perform on his or her on behalf to maintain life, health, and well-being. Self-care agency, which is a human ability, that is the ability for engaging in self-care conditioned by age, develop, mental state, life experience, socio-cultural orientation, health, and available resources. The therapeutic self-care demand, which is the total self-care action, to be performed over a specific duration to meet self-care requisites by using valid methods and related sets on operations and actions, and the self-care requisites, which include categories of universal developmental and health deviation self-care requisites. So the second, I'm going to describe about self-care deficit. So what is self-care deficit? So what is Dorothea Orem describes about self-care deficit? So she describes the specifies when nursing is needed. That is, nursing is required when an adult is incapable or limited in provision of continuous effective self-care. In self-care deficit itself, it has 5 methods of helping, that is acting, doing, guiding, support, promote, and teaching.
Hi everybody, I'm Rifat. I'm going to continue after Lakshmi. So I'm going to explain nursing system. The theory of nursing system describes how patient self-care need will be met by nurse and by the patient or by both. Orem identifies 3 classification of support modalities to meet the self-care requisite of the patient. There is wholly compensatory system, which encompasses total nurse care. It is applicable where patient is unable to do for themselves. For example, a stroke patient, where a nurse does the total care for the patient. It's also the good example for this is also quadriplegia patient or patients with hemiplegia. Partial compensatory system is the system which involves both the nurse and the client sharing in the self-care requirements. For example, a nurse sets up the tray for a client who is able to feed himself. And the educative supportive system is the one where nurse acts as a consultant. She teaches or resources a person. Clients are responsible for their own self-care. For example, a patient with diabetes where nurse educates the person about medication.
Mrs. X, a 34-year-old African woman, was brought into the hospital after fall at home. She lives with her daughter after her husband died 8 years ago. She was alert with a slurred speech on admission. Her daughter said that her mother fell on the floor when she tried to get off the bed and go to the washroom. Mrs. X stated that her left arm and left leg were weak and numb at that time, and she was not able to control it. She has a past medical history of hypertension and also a brief history of left-sided weakness and numbness last month, but resolved which she did not seek treatment. Client assessment. Subjective data. Left hip hurts, pain levels 8 out of 10. Sharp pain and get worse when moving and does not want to be touched. Feeling depressed and fearful. Requires help with the ADLs. She sometimes forgets to take her maintenance medications. Denies short of breath and chest pain. Objective data. Vital sign was taken. Blood pressure 150 over 100. Pulse 110. Respiratory rate is 18. O2 set 96%. Temperature 37.8. The patient was alert, oriented, and able to answer questions appropriately, but slow in responding. Left arm and left leg are weak and numb. Left leg has weak pedal pulse, swelling, redness on left hip, tendon to touch. Medical diagnosis is TIA. Medical treatment is medication and physiotherapist. The patient is currently on the medications as follows.
Okay, client assessment. The first one is basic conditional factors. Age, Mrs. X is 34 years old. Gender is a female. health status, disability due to health condition and fall, need assistance to the activity daily living. Development status, adult who is general activities, currently is stagnations. She prefer to stay at bed. Social culture orientations, high school and undergraduate and African culture. Healthcare system, looking for the healthcare in the institution healthcare. Family system, she's a widow and her husband died 8 months ago, so financially supported by her daughter. Patterns of living at home with her daughter. Environmental, cannot perform ADL properly, and no special precaution to prevent injury. Resources, current Mrs. House only have her daughter and some distant relatives. The second one, universal self-care requisites. The air, the patient denied short of breath and chest pain. Water, fluid intake is a sufficiency, and no edema, skin torture is normal for her age. Food intake is adequate. Nutrition status monitored well by her daughter. Eliminations, void and eliminate bowel movement is normal. Activity and rest, limited movement to the affected limb. Severe pain to the affected hip, need help to do the ADL. Social interactions, the patients communicate well with the staff, sometimes just call her daughter by phone. So prevention of the hazard, need some instruction how to prevent for fall. Promotion of the normalcy, has a good relation with her daughter. The third one is a developmental self-care requisites. Maintenance developmental environment, able to feed herself and difficult to perform dressing, grooming, bathing, and going to the washroom. Prevention of the condition threatening to the normal development. This is her feeling to her daughter that she feel depressed and fearful and have another stroke. The fourth one, health division self-care requisites. Adheres to the medical regimen, cooperative and complying with the care and the medical regimen. Aware of the hypertension problem, not aware about acute disease process, and not aware about the beneficial of the maintenance medication. Modification of the self-care to modification of the self-image. Become more dependent and prefer to stay in bed in the most of time. Complain with the scheduled therapies. Adjustment of the lifestyle to accommodate the change in the healthcare status and the medical regimen. Adjusted with her hospitalization, pain tolerance achieved by repositioning and the pain reliever.
Okay, therapeutic self-care demand are air, water, food, elimination, activity, solitude or interaction, prevention of hazards, promotion of normalcy, maintain a developmental environment, maintenance of health status, adherence to the medication regimen, and awareness of potential problem. We come up with 4 inadequate therapeutic self-care demand, which is the activity, prevention of hazard, maintain a developmental environment, awareness of potential problem. And we prioritize the activity and the prevention of hazard in our nursing care plan. The design of nursing system, we had a supportive educative system. Our nursing care plan nursing diagnosis is risk for falls related to altered mobility secondary to left-sided weakness as evidenced by history of falls. This one belongs to our therapeutic self-care demand, which is prevention of hazards. The client goals would be to prevent the falls and injury. We have several nursing interventions with rationale. Number 1, we never leave the client alone. The rationale is to determine the patient needs. Next is keep the bedside rails up or low bed to prevent falls. Assess gait or level of consciousness to assess the ability of the patient. Next is use supportive devices. Rationale is to handle self. The next interventions is to provide a safe environment for the patient to reduce risk of injury or fall. The next one is involve family members to provide support as needed. The rationale would be enhances commitment. Then we come up with an evaluation which the patient remain free from injury, and patient explain the various measures that she will take to prevent the injury or falls. Then the next therapeutic self-care demand, which is inadequate in our case, is the activity. The design of nursing system, we have supportive or educative. The nursing diagnosis would be self-care deficit related to limited limb movement secondary to current diagnosis. The client goals would be to achieve optimal levels of ability for self-care. Our nursing interventions with rationale, we have to assess the hindering factors present to the patient. Next, we have to provide support, to provide information to the patient so as to promote wellness. Next is to provide passive or active exercises. The rationale would be enhanced capability. And toileting training using commodes to control the bladder and provide assistance. The rationale is the patient needs empathy. And next one is to provide positive feedback so as to increase self-significance and provide pain management to eliminate the cause of immobility, and also provide dressing so as to ease movement. Next is teaching the family the limitation in the activity level of patient. The rationale will be enhances commitment. Next is developmental environment to maintain patient self-esteem. Then we come up with our evaluation. The first one is patient was to perform some activities of daily living. Number 2 is verbalize and improve comfort and self-care ability. And the last one is dressing with minimal assistance. And the partly compensatory system was useful.
So after our group presentation, we came up with the conclusion that Orem's theory can be used to examine the self-care needs of the persons, and nurses' role is to assist and support in meeting those needs in order for a person in ill health to become healthy and well. Certain self-care needs must be met. If the person is not capable of providing any self-care, the nurse would be responsible for providing most of the care. On the other hand, if the person is fully capable of providing basic self-care, the nurse would be the supporter, educator, facilitator of the self-care. Orem's approach to nursing process provides a method to determine the self-care deficit and to define the roles of patient or nurse to meet the self-care demands. Orem's self-care theory examines how the person attains healthy state through self-care by themselves or with the help of a nurse. Orem's theory is applied mostly in hospitals, as people who come to hospital are more or less in self-care deficit. It is also applied in rehabilitation centers and primary care, where patients are encouraged to be independent. It focuses on illness relieving. Orem's theory is simple yet complex. It's very easy to use in all settings, especially easier for novice nurses. In our opinion, Orem's theory is easy to use in making nursing care plans. For example, in our case scenario, we were easily able to make care plan for Mrs. X, assess her situation and implement our interventions.
Pas à toi, tu es à moi, que cela résonne et